industry with you. So I hope this seminar is helpful for you and your loved ones, like especially those like the seniors, your parents, and so on. And then if they need the healthcare, that is it's my pleasure to help. Okay, so can you see my screen? Yes. If you see the screen, can you type 111 in the chat? Okay, thank you. Thank you. Okay, so let's get started. Today, we're going to touch base how to choose Medicare, Obamacare, and Medicaid. So, you know, I know that a lot of you heard about Obamacare and Medicare and Medicaid, but this industry, to be honest, before I enter into this industry, it's very complicated. And even now, when I already into this industry for years, I still feel like every maybe 2-3 days, I found something new. So I just keep learning and improving myself. So hopefully this seminar can help you to get some idea of this industry and help you if you have anyone that around you that need this healthcare insurance, then it'll be my pleasure to assist you. And then this is these are my the Nine Fortune QR code and the WeChat QR code and my WhatsApp QR code. Welcome to scan and just add me if you have any question. Okay. So let's move forward. Okay, first of all, I would like to introduce myself. So I major in portfolio investment and financial in Jinan University. And after working in a company that was about to go public for a few years, I created and established my own import and export company and building material manufacturer. And due to my good luck and my hard working, my company has a revenue of hundreds of millions. And in 2008, I semi-retired and got to know the life insurance. And I purchased a lot of policies for the needs of protecting my assets, creating stable income stream and maintain a family heritage. And also took the exam and achieved the insurance license to help others for the assets allocation and the retirement planning. And when I came to the United States, I moved to here, and then I closed I sold my Chinese company, and then I became a certified yoga teacher and aerobics instructor as per the field of my interest. In order to learn the local tax and the retirement system, I started from scratch to learn the insurance laws and regulations in the United States, and acted as a licensed sales agent in the top 3 insurance company. I became a top producer due to, I got very good mentor and also very good coworkers, and I thanks for their help. And then I became top producer after 1 year, and then I got promoted to be the manager and lead teams. And now I have 18 states license. And I was fortunate to meet Nine Fortune through my sponsor, Lydia. I agree with the cross-industry alliance services platform very much. And I'm going to dedicate myself to the company to help the company to go public and globalization. That's my pleasure to do so also. Okay, and then today, again, our topic is how to choose Obamacare, Medicare, and your health insurance. So to answer this question, I think that the main, it's very important that you want to know some concepts. And then after you know some concepts, get into know why it is important and know what's the type of insurance that it's available for you to choose. Then we come to the conclusion, how to choose. And then I will also provide you some additional information and also my contact information in case you have any question that you want to ask, then you're welcome to do that, to add me. Okay, so as I said, first of all, I would, to help you to understand this industry, I would like to talk about some basic concepts. First, I would like to talk about when and how the health insurance in the United States initiated. So during the Civil War, the explosion happened a lot while traveling with trains and steamboats. Accidents occur frequently. Then in 1929, people formed the first health insurance company, cover the expenses of the inpatient hospital. That's the Blue Cross today. And also 10 years later, people form another health insurance company, cover the expenses of doctor visit and other medical services, which is the Blue Shield today. And then after some time, these two companies joined together and become Blue Cross and Blue Shield. And this is also the first company that I worked when I started my health insurance career. Okay, so let's talk about the basic concept. You might already heard a lot about Obamacare, Medicare, and Medicaid and so on. So I know that's a kind of complicated, but I want to clarify that Obamacare is not an insurance. So Obamacare, it is an act. It's called Affordable Care Act. Then the abbreviation is ACA. So why it called Obamacare? Because at that time, President Obama is in the place. So he initiated this a lot of the health insurance regulation about the under 65-year-old, because for the people over 65-year-old, it has been established for a long time. So that's why at that time when he established more regulation about this industry, especially for those under 65, then the people use his name as Obamacare. And the regulation, including those regulated the Medicare and the people under 65. So Medicare is for the people that either over 65-year-old, or that if they are under 65-year-old, they have been disabled for 2 years. And so, and under 65 is the one that we're talking about. They have the Affordable Care Act. So Affordable Care Act is also talking about you are going to get some tax credit, or you have some financial assistance from the government that can reduce the cost of the health insurance and the medical cost, so that like everybody are affordable to the care. That's why it's called Affordable Care Act. And then Medicaid. Medicaid is not an insurance. Medicaid, it's a state level of financial assistance. So when that is not only with the Medicare insurance, but also the food stamp, and also the students go to the college, and also the students like they have the free lunch in the school and so on. That's a lot of serious financial assistance for the people that have the low income. And this is the state level of financial assistance. And also I want to touch base about the HMO and PPO. So, when I have my health insurance through my employer, but I was not with the health insurance business. Then one day I called the doctor office, and then they asked me, are you with the HMO plan or a PPO plan? I said, what? I have no clue what you're talking about. I know nothing. And then later I found that when I go to visit my primary care doctor, like wellness checkup, they said, oh, free, you don't have to pay. So there's a lot that, okay, so let me learn about that. So at least now here, let's talk about the HMO and the PPO. So HMO stand for Health Maintenance Organization, and then PPO stand for Preferred Provider Organization. This two is kind of a pair that you can do the comparison. So basically, HMO is you always need to stay in the network. And if you go to see a specialist, you need to get a referral from your primary care doctor. And also, if you go out from the network to receive treatment, you won't be covered. Only when you are in emergency scenario, then you will get covered by the insurance. Otherwise, if you have an HMO plan, you have to go within the network providers. But PPO, that's on the opposite. So PPO plan, you can go in and out of the network. But of course, if you go to the in the network providers, then you're going to save some money. And also when you go out of the network providers, you more than likely you're going to pay higher copayment. And also sometimes the providers can deny to treat you because they don't have a contract with the insurance, the carrier, the insurance company. Okay, and then let's talk about the DED and MOOP. So DED is a deductible. So deductible means the plan start to pay on behalf of you after you meet this amount. So this deductible, that is like some expenses not apply to deductible. For example, like some Medicare Advantage plan, the co-payments, the immunizations, and the doctor visits, those are not applied to the deductible. And another concept is a maximum out-of-pocket, which is MOOP. So that means the regulation cap your maximum out-of-pocket in the year, the whole year, that you don't need to worry about that you will get a huge bill if you have a very severe sickness. And also maybe you have an accident that you got hurt seriously, then when you pay from your own pocket up to the maximum out-of-pocket amount, so the rest of the year, you only need to continue pay your premium, but you don't have to pay any co-payments, any services fee. That's the maximum out-of-pocket. And also co-payment and co-insurance is also a pair of concepts you can compare. So they basically have the similar meaning. The main difference is co-pay is a flat amount, like $30, $50, something like that. And the co-insurance refer to a percentage. For example, if you need to see your specialist, then you have a co-insurance of 20%, or you have, for example, like $30 as a co-payment. So when it refers to a flat amount, we use the term of co-payment. And then when it reflects as a percentage, we use the term of insurance, co-insurance. And also we will touch base part A, B, C, D, which from the Medicare. And also we will talk about the Medicare supplemental plan. It's also called Medicaid. And we will get down to that part later on. Okay, so let's talk about the enrollment period. So there's a lot of terms. It's called like AEP, OEP, SEP, ICEP. So what is AEP? AEP stands for annual enrollment period. So you can understand from the word is like every year we have a specific enrollment period that the government open for you to choose a plan. If like, for example, I don't like the plan this year, but I have to keep until the end of the year. And then during the AEP, it allowed me to change a plan. So that's an AEP. And OEP, it's about, if we talk about the Medicare plan, that is after you choose the AEP, choose a plan, but you don't like it, if you choose a Medicare Advantage plan, if you don't like it, you have, during the OEP, you have one chance, one opportunity during the whole year to change into a different plan. That's for a Medicare, but if for the under 65-year-old, then it will consider as the annual enrollment, same meaning. So the AEP, the date from October the 15th to December the 7th, and the OEP for Medicare is January 1st to March the 31st. And the OEP for this under 65, it's November the 1st to January 15th. So those are basically those are annual enrollment period, but use a different term on a specific scenario. And then special SEP stand for special enrollment period. That means you have to have a special life event. For example, you are losing a family member, or you're gaining a family member, you're moving your home, because most of the health insurance plans, they design based on the county. So if you move to a different county, then you have the right to change your plan. And also you have to update your address. And then if there's not the same plan available in your new area, you have to choose a new plan in your new area. That's the SEP. And then ICEP, that's an initial enrollment period. That is like when you are aging into 65-year-old, then you will be in the ICEP. And also, so that is the enrollment period, that's a different one. In fact, it's a lot more detailed, but I think today we want to just touch about the most popular, or the most that we might see, we might need to use as most of the people, the majority. Okay, and then the Medicare enrollment period, that it's as I just now said, is the AEP and OEP, and the SEP and ICEP. And the under 65, they don't have the AEP and they don't have the ICEP, only OEP and SEP. And then the Medicare, and that's a Medicare supplement plan, and that has, okay, all year round, you are allowed to get a Medicare supplement plan. It's also called Medicare, but you do have one time, is 6 months after your just age in 65, that you have 6 months, we call OEP, that you can enroll in a Medicare supplement plan without being asked some medical question. The medical question is ask you about your health status. So for the Medicare plan, the regulation allow the carrier deny to accept your application. That's about the underwriting. But for the Medicare, like later on, we'll touch about Part A, Part B, Part C, Part D. Those they cannot deny you. That's because that's a Medicare regulated products. And then so for the Medicare, when we come back to talk about the Medicare, it's just like if you are within the 6 months on the OEP, then you don't have to be asked the medical question. That means even you are already serious sick, then they have to accept your application. That's we call the guarantee issue. We will touch about that later. And then the dental and vision plan that doesn't have any enrollment period, you can enroll all year round. That's the enrollment period that we touch about. And then now we come to talk about the contract length. So basically all the contract length will be 1 year. So to the end of the year. And then usually it will renew automatically. But so if you don't do anything, then your plan will be automatically renewed. But I will recommend you to review at the end of each year, because there are several changes might happen. The government regulation will happen. For example, like Last year, the Part B premium, it's $171.10, and this year is $164.90. And there's a lot of other regulations that it will have changed. And also the company's products, it will also change. So some people, every year the carriers, they have the product team that they design the products to consider, like, okay, when they do some research on the market, and they will see, okay, this kind of plan that is more popular, and then they want to enlarge their footprints into more areas, or maybe they increase some other plan types in the same area. So you might have more options in the upcoming year. So that's why I want you to do some review at the end of the year. And also for yourself, your health situation might be changed, your family situation might be changed. So for example, if you are healthy now, so I just want to get a plan that have low premium, that means I pay upfront less, but when I need to use the services, then I pay from my own pocket, like more money on that. Because I feel like more than likely, I might not to use the plan, just I want to have a plan in place that if anything happens, then I won't have a huge bill in front of me. So I don't know how to deal with that. That's in that case, you might want to have a low premium plan. But for example, like this year, that, oh, I have a cancer, or I already know that I'm going to have some surgery and some hospital stay and so on. Then in the case, I think, okay, then I will choose a plan with less premium. But when I use plan, the co-payments, co-insurance will be less. Then finally, my overall cost for the year will be less. That's why we always say that I will recommend you to review with your the sales agent that to see if your plan is still the best one for the upcoming year. And the professional are paid by the carrier, not paid by the consumer. So for you if you got the review from the professional, you don't have to pay. That's free for you. Okay, so the next part we will be talking about why the health insurance is so important. So first, one concept very clear is why insurance. So insurance is more than likely is like when you have nothing bad happen, then everybody gives some money, put some money together, and then the money goes to who that might need this help. So, so with this insurance plan, then you will save your medical expenses. For example, like if you have a diabetes, that the average treatment will be $55,000 to $130,000. That's a lot. So for example, if you just have a plan that with a premium like 100 or even less than that, then the whole year you're gonna pay only $1,200, but you save those $1,500 to $130,000. And also for you, if you deliver a newborn, then the average cost will be $5,000 to $11,000, depends on if you are in the C-section or the vaginal delivery. Okay, and then for all the preventive services, it's zero co-payment, like including the mammogram, the first-time mammogram, and the blood work and the wellness checkup, and the preventive screening will also help you to reduce the medical expenses, as you found it earlier, and can be treated easier, and your cost will be lower. And also, Obamacare has a penalty, but in some states, it has been canceled for the year from the year 2022. Oh, by the way, I want to say that the Obamacare that just now we talk about is a Affordable Care Act. But as a lot of people, I just explained just now, because it has more regulation about the under 65-year-old, and also talking about the financial assistance from the government. So mostly, a lot of people, when they talk about Obamacare, is talking about those people, the plans for under 65-year-old, and also get some financial assistance from the government. That's we usually talk about, refer it as a Obamacare. Okay, and also if about why that we need to get a health insurance. That another reason for you is if you have the Medicare, but if you don't enroll in time, then it's a lifetime penalty. Part B, it's a 10% per year. And Part D, which is the Part B is the doctor visit and the other treatment. And the Part D is the prescription drug. And the Part D is 1% per month. That's lifetime. You cannot get rid of it. And then also another reason for you to get the health insurance is when you are in the bracket of the income, like low income, then you can get the financial assistance through advanced premium tax credit and also the cost share reduction. So I will talk about that later on in a detail. So that we at least hear from here, I want to say that if your family income, it's within 100 to 400% of the federal poverty level, then you will be eligible to get some advanced premium tax credit. And if your income is between 100 to 250%, then you'll be eligible for cost share reduction. So cost share reduction is a secondary financial assistance. So with the cost share reduction, even you are on the same plan with others, then your co-payment is much lower. That, for example, if that's without the cost share reduction, your specialist visit might cost you $50, but with the cost share reduction, you might only need to pay $5 or $10, something like that. And also, there's another financial assistance called low-income subsidies. That's the subsidies to help you to save the cost of the prescription drug for the Medicare. And also the Medicaid, we touch about that. It's about the financial assistance that can help you to reduce your insurance costs. If you have the Medicaid, so basically like later we'll talk about the Part A and Part B like premium. Then if you have Medicaid, they can help you to pay. So even though that's a federal regulation that you have to pay, the mandatory that you have to pay the Part A and Part B premium, but with the Medicaid, your premium will be zero. Might be zero, but might be some expenses, depends on what's the level of Medicaid. Okay, so after we talk about why it is so important to get a health insurance plan, now we are going to go deeper to see what is how the Medicare and Obamacare and works and what is that. So first we talk about the Medicare. So Medicare, it's about the person, the people that over 65-year-old or the under 65-year-old with disability. And the types can be Part A, B, C, D. So I want you to know that Part A, B, C, D is not like, it's flat, like A and B and C and D, and then you got one, I got A, I got B, I got C. It's not. So I will explain it to you. Medicare Part later on. So, and then also you have Medicare supplemental plan, and then the dental plan and vision plan. So just now we talk about ABCD is not the same level. So first, let's talk about the Part A. So the Part A, it's referred to the coverage of the hospital stay, inpatient hospital. So if you file tax over 40 seasons, that means it's about 10 years when you file tax within the United States, and you are qualified for free Part A. So there's no premium. Otherwise, you might be charged like $499, $233, or $600. Depends on how many years that you already filed the tax. That's the Part A. And Part B, it's about the doctor visit and imagings and so on. And it is income related. You know, just now the Part A is the year that you file tax related, but the Part B, it doesn't matter how many years that you have filed tax, but just related to the income that you are getting. So the standard one for the year 2023 is $164.90 per month. But if you are in the low income, then if you are in the low income, then you might pay less because, for example, like the low income subsidies will help you and the Medicaid will help you. And then if your income is higher, then above this standard Part B premium, you might need to pay the additional adjustment amount due to that you have higher income. And and then we talk about the Part D. The Part D is talking about, it refers to the prescription drug coverage. So it's also income related. Average in the year 2023 is $33, but this is not a standard amount. It depends on the company, the carriers. So for this one, we can only say that's an average, $33 per month. And with the prescription drug, also there's one regulation, it's called donut hole. When the drug cost is between $4,660 and $7,400, then you are in donut hole. When you are in donut hole, that you'll be responsible for 25% of the drug cost. And then if you come out from the donut hole, that means the drug cost is over $7,400, then you'll be either responsible for 5% of the drug cost, or you pay $4.15 for the generic, and then $10.35 for other drugs. So that's the Part D prescription. And then let's talk about Part C. So Part 8B, D is simple, but Part C is quite complicated. So I am going to talk about that in a different section. And also we will talk about the Medicare supplemental plan, and that also I will use another section on page 8 to talk about that. And here, let's touch about the chronic illness and SMP plan. The SMP stand for Special Need Plan. So these plans are designed specially for the people with the chronic illness, for example, like diabetes, heart condition, or the lung condition. If you are qualified for this plan, basically your drug cost will be different. You might have a favorite cost for the drug, and also you might get some extra help, like we call the healthy option benefit. Like we will some company, they will give you a Visa card that you can purchase food, you can purchase for the aging support, a pest control, pet care, or the rent, utilities, and internet. You can use those money to pay for that. So with the special need plan, you might get the extra benefit like this. And then we'll talk about also the Medicaid and the low income subsidies. Also with the Medicaid plan, that if you are eligible for both Medicare and Medicaid, you'll be eligible for dual eligible plan. But the dual eligible plan also will depend on your Medicaid level, but we're not going to go so deep. So it's just saying that, like, if you are eligible for both Medicare and Medicaid, you will also be more than like you'll be eligible for the dual eligible plan, then you also have the extra help like the food card, as I mentioned just now, and over-the-counter products and so on. Okay, so now we talk about the part for the Medicare. We talk about the Part A, Part B, and Part D. So now I am putting this Part C as a special section to talk about that because that's a more complicated. So Part C it's a combination, either Part A and Part B, or combination of Part A, Part B, and Part D. So here I said that, okay, it's if you have the original Medicare, that means you don't enroll in, you only have the Part A and Part B. That's what we call original Medicare. But if you enroll in a Part C plan, that you're going to have some extra benefit, like just now we say the food card, the dental, vision, and hearing, and then some over-the-counter products, because those are not regulated. The carriers doesn't have to offer you this coverage. But if you are in the Medicare Advantage plan, those is kind of standard now. Every company, they have the Medicare Advantage plan, the same as Part C, that give you some extra benefit. For example, like the dental, vision, and hearing, and the over-the-counter product, and the silver sneakers. Some they offer you this insulin saving program. So insulin is for the diabetes. So that's a very good extra benefit. And then we talk about the enrollment period just now. So I've just skip here. And then type also, we have MA and MAPD. So MA is a combination of Part A and Part B. MAPD is a combination of Part A, Part B, and Part D. So that's the difference. And then the HMO and PPO, we already touched about that. So it's the same concept. And expenses for the Part C, also called Medicaid Advantage plan, that the mostly they have a zero premium. You only need to pay your Part B premium. And then even though some plans, they have some premium, that what I can see right now mostly is less than 100. So you are paying very low cost, and then you have a lot of extra benefit. That's why that's a very good option for you to get into a Medicare Advantage plan or the Part C. And also the Part C, you got the extra benefit like we talk about the vision, hearing, and the dental. Also, some of the company, some plans, they give you a Part B give back. So as I said, when you have the Part C, the Medicare Advantage plan, most of them, there's zero premium, and then you have to pay the Part B premium. But some plan, the company design that even they help you to give you some part of full amount of the Part B premium. So for example, the year for 2023, that the Part B standard premium is $164.90. Some plan, they design like they can help you to reduce the Part B premium up to $100, and some even up to $164.90. That means if you take that kind of Medicare Advantage plan, the Part C plan, you don't have to pay the Part B. So that's a big saving. And also the OTC means over the counter. And then that's about the wellness products, and also the, some products is not prescribed that you can use towards those products if you have this plan. And then also the silver sneaker, which is a fitness membership. So with this membership, you can go to the classes, you can go with the machine in the gym, and that will be covered in full. And also some plan also offer you the free transportation, medical and non-medical. So those are the extra benefit. And then travel benefit means more than likely, when you have a plan that we say, okay, based on the county, but when the plan offer you the travel benefit, that means it depends on different plans. But for example, if the plan says that you have the travel benefit based on if you are traveling within the United States, and then if you stay in the network, then you will got the travel benefit. That means when you go out of the state. So for example, I live in Florida, but I travel. A lot of snowbirds, for example, the people in Chicago, they have a vacation home in Florida. So like maybe 5 months in a year, then they fly to Florida to spend the summer to winter time. And then majority, like more than 6 months, they are living in Chicago. So in that case, if the plan comes with the travel benefit, and then even that 5 months they are living in Florida, they still got covered, and they still can go to visit the doctor like regularly instead of an emergency only. And also another term is called POS. POS stands for point of services. That means with this plan, even that's an HMO plan, then you don't have to stay in the network. So we talk about the HMO plan that you need to stay in the network. Otherwise, you only be covered when you are emergency. But if you have the HMO POS plan, that means you are covered even you are in and out of the network. And then the cost will be the same in and out of the network. And also some plan, they offer you food card, the expenses card, gift card, and so on. So that's an extra benefit. Okay. So just now, the part C is talking about the Medicare Advantage plan. And now we will talk about the Medicare Supplement plan. It's also called Medicare. So there's several facts I want to talk about regarding the Medicare plan. One is what is and how to use. So Medicare plan, it's a supplement plan. So your original Medicare plan that pays 80% on behalf of you. And then the 20%, if you have a Medicare plan, then the 20% you'll be covered, and more than likely you don't have to pay. But they will have the deductible. So that on the right side, we talk about the Part A deductible and Part B deductible. So then some of them, when you pay up to the deductible from your own pocket, and the rest of the year, because the Medicare, original Medicare pay 80% for you, and the Medicare pay 20% for you, you don't have to pay. But the Medicare have a cost that it's about 100 to 400. Basically, it's also depends on where and what plan and what's the benefit. And we do have some, it's called high deductible Medicare plan. Then it's lower, it is as low as maybe $60 a month, but your deductible is kind of like $2,000-3,000. So you have to pay from your own pocket up to, for example, $2,000, and then the plan will start paying for you. So basically, if you say on the cost, if you are healthy or you're not in a severe situation with the sickness, then Medicare plan it doesn't help you to save money. But some people, they don't focus on save money. They focus on a peace of mind, a peaceful mind. So when you have a Medicare plan that you pay on a monthly basis the premium, and then when you use the service, mostly it's like after you pay up to the deductible, then the original Medicare pay the 80% and the Medicare pay the 20%. I just go to get the service and go. I don't need to worry about how much is my bill. So for the people, if you are not focused very on the upfront cost, or if you are on a severe situation, then the Medicare, it's a good choice. So we want to say that how to choose a plan is about your need. We don't have any plan that is always the best for everyone. And also we talk about the enrollment period. Then we have the open enrollment period. Just now we talk about that. It's 6 months after your first initiate age in 65-year-old. And then during that period of time, you are not allowed, the carrier not allowed to ask you any medical question, even you are in the very best situation on your health. They have to accept your application without asking you any question about your health situation. So that's we call the guarantee issue we're talking about here. And then also Medigap has a different different regulation on different states. Basically, it depends on the states. They will have some different regulation on that to give you more detail. We're not going to touch the detail on each states, but you can have a concept that different state might have some different regulation. And then talk about the type. The type, I'm going to talk about it in the next page. So basically, Medigap has different type, but a different company, it has the same standard type. So it's always like Plan A, Plan B, Plan D. It's not the same as Part A, Part B, and Part D. This is Medigap plan, Plan A, Plan B, Plan D, G, K, L, M, N. So with the A, that means, okay, so the best coverage, it's a F, but the Plan F, it is not, if you are not eligible for Medicare, before 2020, the year 2020, they're not going to sell you that one because now it's not allowed to sell any new eligibles after 2022. If you have a plan already in the last year, and then you can use the grandfather regulation to keep this Plan F. But for the new eligibility after the year 2020, there's no more Plan C and Plan F. You see the Plan C and Plan F, they cover everything. And then special the Plan F, even the Medicare Part B excess charge, the Part B deductible, those are covered. But all these plans, you see that the Part B deductible here is not covered. So you will have the Part B deductible of $233 when you take all these plans. And some plans, they will have less coverage. Basically, it's when you are paying higher premium on a monthly base, then you will have a better coverage like Plan G. So other than the Plan F, Plan G is the most expensive if we say the same area, same company, same carrier. Okay. And then, so just now I was talking about the Medicare. It's those of 65 over 65-year-old. And then later now here, we're talking about the under 65-year-old. That's all generally we call Obamacare. So Obamacare, you have the different type plan type. We use the metal type to name the plan. So the blonde, silver, gold, platinum. And those basically, if you are paying the high premium, then you are in the platinum plan that your premium will have 90% goes to the medical cost. That means if you are also have a severe medical like health condition, then you might want to have a high medical metal level like platinum or gold. But if you are healthy, then you might want to have a bronze or silver so that you have a less premium. And also the type also including dental and vision. And mostly the dental and vision, it's same. If the standalone dental and vision, then it doesn't matter that how old are you, under 65-year-old or over 65-year-old, that will be the same if those are standalone dental and vision plan. And then so the regulation specifies the 10 conditions that that you have to have this 10 essential coverage, and then I will touch about that at the next page. And then also in the Obamacare, we also have the HMO plan and the PPO plan. It's the same meaning as we talked about that before. And the advanced premium tax credit, as we talk about that, is when your income is between 100 to 200 federal poverty level, and you'll be eligible for tax credit. And that tax credit, it can be maybe $50 or can be hundreds or even can be thousands, depends on your family income and also how many family members that you are having. So it's a basic concept. It's like if you have more people in the family, in the household, but you have less income, so that you will be in more tax credit. That's the main concept. And then for the cost share reduction, it's when your income is between the 100 to 250% of the federal profit level, then you'll be in CSR, which means stands for cost share reduction. And then that's the secondary financial assistance, addition to the tax credit. And then again, the Medicaid, it's because it's a state level of financial assistance. So different state will have the different regulation. Okay, so just now we talked about the essential coverage. So for the Obamacare, they regulated that this 10 for every plan for the Obamacare have to cover this essential benefit, this 10 essential benefit, including the ambulatory patient services. That's also means outpatient services, and also the preventive and wellness services and chronic disease and management. That means what I said, like your first blood work, your mammogram, and your wellness checkup. It aligns on this benefits, and also emergency services, hospitalization, laboratory. Those are the laboratory itself. Okay, if that lines to the wellness, you don't have to pay. But if that's a diagnostic purposes, you are covered, but you have a co-payment or co-insurance from this services. And then also the maternity and the newborn care, and mental health and substance use disorder services, including behavioral health or treatment. So that basically is a mental health issue. And then the pediatric services, including the oral and vision care. So, most of the dental care, the dental plan, you will have a maximum benefit or the deductible. But for the kids, the pediatric, so basically they don't have the deductible. And also, for example, like the braces, if you are an adult, more than likely you're not covered. Your braces is you have to pay in full by yourself. The insurance won't cover you. But if that's for a kid under 18-year-old, if that's a medical necessary, then you'll be covered. So the medical necessary, it depends on the doctor will submit the application to the insurance company, and then the insurance company will approve it is a medical necessary or not. If that is approved, then you got covered. If not, then you still have to pay on your own. Okay, and then it will cover you the prescription drug and the rehabilitations. Okay, and then above we talk about the about the Medicare and the Obamacare, and now we talk about the financial assistance. As I said from the beginning, Medicaid is not an insurance, so it's a financial assistance. And LIS stands for low income subsidies. It's also a financial subsidies. But the Medicaid is a state level. The low income subsidies is the federal level. So that's two different level of financial assistance. And then, so what is Medicaid? Who is qualified for Medicaid? And also different states have a different regulation. Most of the states, if your income is below 100% of the profit level, you'll be eligible for Medicaid. And some states, they use the standard of 138%. And then for the under 65 year old, if, for example, like the Florida, okay, different states have a different regulation. So basically the Democratic states, they will give you, even you are between 18 to 65 years old, you will be eligible for Medicaid. But some other state like Florida, or some other state like it's that they don't believe that between 65 and 18-year-old, they believe that you have to work. If you say that, oh, I don't have income, then they say, no, I'm sorry, I don't give you Medicaid. So you have to work. Otherwise, you have to pay full amount of your health insurance. So that's different state have the different regulation. And then also the Medicaid level, they have different level like FBDE, QMB, and QMB plus. And I'm not here to go into the deeper like that. And then benefit more than health insurance. So it's like the Medicaid, as I said, Medicaid is not insurance. So the food stamp, the student grants, those are Medicaid also. And the LIS is low cost subsidies. It's a reduction to the Part D prescription drug costs. And just now we talk about the advanced premium tax credit and the CSR. It's a cost share reduction. It's talk about the use as towards the under 65-year-old people. And then and if you use for a Medicaid to pay for long-term care, and you might lose property. That's here I want to give you a concept like, okay, so okay, I don't have money, I don't have property, then I don't have money, and then I have low income, then I will just use long-term care and the Medicaid will pay for it. Yes, you're right. But if Medicaid pay for it, it's at the condition of that you don't have any property. If you have any property, they will take your property first to pay for the long-term care expenses, and then the government pay the rest. So in this case, I would like to say that in this case, we are related to the life insurance, and you don't want to just say that I have Medicaid, then I can go with the long-term care without any expenses. That's true, but it's like not always true that you have to consider if you have any property, and then it will go to your property. And then if you transfer your property to someone else before you got to the long-term care, then they will go back 5 years in your record about the property. Okay, so after all this, I think we come to the conclusion. I think you already know that what's the conclusion. So first, it's not the best plan for everyone, always best plan based on specific needs. And also different area has different products available, and those are based on the county. So then we want to say that how to choose your Medicare plan. Now you know that. May I have some interaction from the chat that tell me how you can choose your Medicare, the medical plan, the health insurance plan? Is there anyone that can tell me how to choose it after we learn this knowledge and share about all this concept, and then tell me how to choose? Is there anybody know that? It looked like you are so shy. Anyway, for the sake of time, and then I just give you the answer like here. It's okay, evaluate your household income. So if you are with the low income, then you'll be in the dual eligible plan, then has a expenses part benefit, or your health situation. If you have the chronic illness, foreseen high expenses, or for medical, such as surgery, imaging, hospital stay, specific medicine, dental, and vision needed, and maybe you need over the counter. So you will consider all this, and then you make your own choice. If a Medigap or a Medicare Advantage plan or a PPO plan or a HMO plan is good for you. And personalize if you are a snowbird that you want to see if there are any travel benefit that included in the plan. And if you have a doctor that you has been with for a long time, then you want to check if the doctor is in the network, so that of course, everybody want to save the money, but you want to see if your doctor is not in the network, then you might want to say, okay, I prefer to pay some more because my doctor is not covered. Then I have to check if my doctor makes sure it's covered, so that I will need to stay with this doctor. So everything, it will be the fact that you want to consider. So again, you want to review every year as the government regulation change, your personal information, the situation change, and your need change, and also the carrier's products change also. So again, I will recommend you to review every year to see if the same plan is still the best one for the upcoming year. Okay, so I'm here to provide additional information. So the Medicare and the Obamacare doesn't include long-term care. And also beside the dental plan, then there's, like, for example, we say the braces, we don't cover you. And for the cosmetic dental services, the plans doesn't cover the dental plan. So in that case, you might also a lot of the implant. Some company, even the dental plan even cover the implant, but most of the company, most of the products doesn't cover the implant. So in this case, you can get a dental saving program that is not an insurance, but with this program, you will enjoy some discount for all the services. It's about 15% to 60%, depends on what services you're looking for. So that's the additional information. I hope that can help you. Okay, so with that, thank you for your time, and then thank you for joining us today. So I would like to say again, this is my Nine Fortune barcode and the WeChat and the WhatsApp. So just feel free to contact me if you have any questions. Again, you will get the free review. Okay, thank you. Thank you, Bruno.
Well, thank you, Eva, for a wonderful, it's a really information-packed seminar. And fortunately, we also have it live on the YouTube channel. So you can actually go back to YouTube live to review all the information if you miss anything. And I encourage you to, if you have further information or further question, to ask Eva about that as well. So let's see whether there's any additional questions. There's such a great lecture. Thank you, Eva. Great. Thank you, everyone. Okay. All right. So if without any further questions, then it's a wrap. And thank you for coming. And hopefully we'll see you again next Tuesday. Next Tuesday, I have invited a friend who's also a very good college consultant. If you have parents who have kids and worrying about how to choose a university, if they're already in middle school or in the high school, it's very helpful. Actually, he helps my daughter to decide on her major before applying for university. And so I think you don't want to miss next week's seminar as well. So go to, I'll put the poster up in a day or so you can start inviting friends next week, Tuesday, and so that it will help some parents and kids to find a right direction of how to decide on a major and how to have a better chance to get into university. All right. With that said, good night and have a wonderful evening. Bye-bye.
Thank you. Good night, everyone.